Hello, long time no see. How are you going? Good. So, I believe you've booked in for your annual checkup, correct? Okay, perfect. Now, is there anything you would like me to focus on today? Nothing in particular? Just feeling a little more tired than usual. Okay, no worries. Now, I will give you a brief rundown of what we're going to do today. So first, I will take your vital signs, so just your heart rate, blood pressure, all that good stuff. Then I'm going to conduct a cranial nerve exam and also a head, neck and shoulder examination, just so we can tick all the boxes and get a nice rounded picture of your overall health. How does that sound? Okay. After that, I will ask you a few questions about your lifestyle habits to see if we can get to the bottom of why you're experiencing this increased tiredness at the moment. I will start by listening to your heart rate as always. Okay. So your heartbeat sounds nice and strong and steady. Now I will take a listen to your lungs and your breathing. Take a deep breath in for me and out. Breathe in and out. Now just breathe normally for me. Okay, wonderful. Okay, so now it's time for your blood pressure. So I'll apply this scuff to your arm. So I'll pump the cuff up now. does get a bit uncomfortable. Just gonna do a bit more. Okay. It's all good. Okay, now I'm going to check your oxygen saturation levels with this gadget here. So I'll pop that on your fingertip. Just turn that on and just wait for a little bit. Okay. Alright, and now I'll check your temperature with my tongue thermometer. So I'll pop that under your tongue, okay? Alright. Okay, now I'll get you to hop on the scales for me and we'll check your weight, if that's okay. Okay. Now, does that seem about normal for you? Yes, it is normal for your weight to slightly fluctuate. Only when there's been a dramatic increase or decrease is when we'd want to investigate further to find out what the underlying issue is. Okay. Now I'll just measure your height. Okay, perfect. Okay, now I'm going to begin the cranial nerve exam, starting with your sight. So, first of all, I'm going to get you to look at a few charts with me. If you could just come over to that side of the room. Okay. Okay, so this chart here is called a Snellen chart, and I'm sure you've seen it before. So this chart will test your visual acuity, so how well you can see without contacts or glasses. Okay, so what I will get you to do is to close your left eye for me first. Okay, now could you read out this line for me? Now this one with the green line under it. Yep. And this line here for me. Okay. Now uncover your left eye and cover your right. Okay. Now can you read this sign out for me? Okay. This sign here with the red line underneath. Okay. Now this sign here, the last one. Okay, great. Now, using your both eyes, can you please read this sign here? Yep. This sign. Okay. Now this sign here. Perfect. Now the next chart I'm going to get you to look at is a colorblind chart. Can you tell me what number you see? Mm-hmm. Mm-hmm. Yes. Wonderful. A little harder this one. Fantastic. Yeah. So we'll just go back over there now. Have you noticed any changes to your vision lately? Okay. Now I'm going to test your visual field. This test is going to let me know whether your peripheral vision is compromised. Okay? So what I'm going to get you to do is close one eye for me. Then I will close that eye on the same side. Then I'm going to hold up different numbers with my fingers. And you just tell me how many fingers I'm holding up. Okay? So we'll start with your right eye. Okay. Okay, very good. So we'll do the other eye now. Okay. Okay, great. So nothing seems to be wrong with your peripherals. So for my next test, I'm going to use my pen light here. I'm going to shine the light directly into your eye, which is going to test your pupil reaction, okay? But it won't blind you, so don't be afraid, okay? So we'll start. So do the other eye now. Great. Wonderful. Now I'll get you to follow the light with your eyes. Okay. Mm-hmm. Wonderful. Now this instrument here is called an otoscope, and it is used for the examination of the eardrum and ear canal. This is going to help me detect whether there are any infections, excess earwax, or objects in the ear canal. So I will just come around to the side of you. So checking for any abnormalities, growths, or anything like that. Okay, come around to the other side. Have you noticed any changes to your hearing lately? Okay. The next test I'm going to conduct is called a speech discrimination test. This test involves me reading words out to you, which I will then get you to repeat back to me. This test is going to allow me to see how clearly you can hear speech. Okay, so we'll begin. Mat, bat, cat, bat. Wine, wise, white, wipe. Okay. Fin, tin, shin, chin. White, right, light, night. Okay, well done. Okay, the next hearing test I'm going to conduct is called a speech in noise test. Now, this test is going to allow me to see how well you can perceive sound and speech in background noise. So I'm going to place these headphones on you, which will then play some background noise. Then I'm going to say some phrases at various levels of sound, which I'll get you to then repeat to me. Okay? So I'll pop these on you. Okay. The book was on the table. She was lost in the dark of night. You won the challenge against all odds. You camped by the river. She was waiting for the rain to stop. The happy dog ran the entire length of the park, using Amy to sniff the dandelions. The lake, frozen over all winter, was finally thawing. Okay, all done. You've done very well. Okay, now my next test is called a whisper test. Okay, this test is going to allow me to see whether your hearing is impaired in each separate ear in any way. For this test, I'm going to come around behind you to prevent you from lip reading. Then I'm going to occlude the opposite ear by rubbing the tragus in a circular motion. Yes, to basically block the hearing from that ear. Okay. Then I'm going to whisper a combination of letters and numbers, which I will get you to repeat back to me. If you have no issues with it, then your hearing will be considered as normal. Alright? Okay, so I'll come around to the back of you now. B, 5, 11, 8, A, 15, 6, 2, W, 20, X, B. Yes, you did very well. I'm sure you're glad to hear. Now for the next couple of hearing tests, I'm going to be using my tuning fork. Okay, so the first test is called the Rinne Test. This is where I will strike my tuning fork, then place the base ear to the bone behind your ear. This will cause vibrations through your skull and inner ear. Then once you cannot hear the vibrations anymore, I'll move the tuning fork to the side of but not touching your ear. Okay. Normal hearing will show that air conduction time is twice as long as bone conduction time. So I will strike it now. So I will do that again to your other ear. So the next test I'm going to do using my tuning fork is called the Weber test. This test involves me hitting my tuning fork, then holding the stem here to the center of your head. Then I will get you to indicate to me where the sound is best heard. So your left ear, right ear, or both ears equally. Normal hearing will produce sound equally in both ears. Okay, so I will strike my tuning fork now. So you heard it equally in both ears? Okay, wonderful. Now that's the end of our hearing test. Next, I'm going to be taking a look at your nose and testing your sense of smell, and also your mouth and sense of taste. Okay, starting with your nose. So I am going to take a closer look. Have you noticed any changes to your sense of smell or smelling things that aren't there? Okay. So for the smell test, I'm going to hold up a few different smells, and I'll get you to tell me what they are. Yes, it is quite fun actually. Can you tell me what that one is? Yes, correct, orange. This one's a little harder. Yes, you smelt it before. Yeah, it is a herb. Can you tell me which one? It's rosemary. Don't worry, that was a little bit hard. Well done on knowing that it was a herb though. Should get this one. Right, peppermint. A little bit more tricky, this one. It does smell good, doesn't it? Yes, lemongrass. That's amazing. Okay, last one. Correct, tea tree. Okay, so you did fantastically in that smell test. I'm very impressed, even getting the lemongrass one. Alright, now I'm going to take a close look at your mouth and do a taste test. So I'm going to use my pen light again. If you could just open your mouth. Okay. Alright, so it all looks pretty normal to me. Have you noticed any changes to your sense of taste or anything? No? Okay. Now for the taste test, I'm going to use a cotton swab dipped in a strong concentration of different tastes on the 4 quadrants of your tongue. Okay, then I'll just get you to tell me what it tastes like. Alright? Okay, so this is the first one. Open your mouth. Okay. Can you tell me what that tastes like? Salty, correct? Yeah. Do the next one. What does that one taste like? Sweet, yeah. Okay, next. Savory. Sour, yeah. And one more. Yes, bitter, very good. Now take a sip of water for me. Okay. Now that concludes the cranial nerve exam. Next, I will conduct a head, neck and shoulder examination. So I'm going to take my gloves off for this one because I will need to feel. Okay, so what I'll get you to do is sit upright with your arms by your sides, looking directly ahead at me. Okay, so first I'm going to take a look at your head, your scalp and your skull. Okay. So I'm looking for any deformities or asymmetries. Lacerations or signs of trauma. Now I'm going to take a closer look at your skull by moving your hair, okay? So I'll do it in a methodical way, starting from your right to your left, Okay. I'm checking your scalp. I'm also looking at your hair growth or lack thereof. Do you feel any pain or tenderness? Okay. Alright, now I'm going to check your face and your neck. Checking for any visible abnormalities, including obvious signs of trauma, skin lesions, or rashes, your thyroid. Now I'm going to palpate your sinuses. Can you feel any tenderness there? Okay. Now you have a number of lymph nodes located in your head and your neck that I will palpate now, okay? Okay. Now could you look up as high as possible for me? Okay, now put your chin to your chest. Okay, now move your head from left to right as far as possible. Now put your left ear to your left shoulder and your right ear to your right shoulder. Okay, perfect. So that is the end of the head, neck and shoulder examination. Now you said earlier that you were feeling more tired than usual. Okay, so I will ask you a few questions about your lifestyle habits. Okay, so how has your sleep been lately? Okay. Do you feel like you can't switch off sometimes? Okay. Now, how are your stress levels on a scale of 1 to 10? Okay. Do you exercise regularly? Okay. Now, what are your eating habits like? Okay. Do you feel like you have a good work-life balance? And how are your personal relationships at the moment? Okay, so I can see here that some of the answers could be contributing factors to your feelings of increased tiredness. Sometimes when we've been living in a heightened state of stress for so long, it becomes like normal for us. Being too busy with work can cause unhealthy eating habits or lack of exercise, not being able to spend time with our loved ones, or even just having time for ourselves to read a book or take the dog for a walk to the beach. This can all contribute to this overstimulated state and cause lethargy. Okay, this is where we need to look at our health from a holistic point of view, finding that balance between work and play and getting enough rest to refuel our mind, bodies and spirit. Okay, this concludes our session for today. I will send you a copy of my findings and let you know in the coming days whether we need to book any follow-up appointments. Alright, have a wonderful day. Bye-bye.